Hello, everyone. Welcome to this symposium. I hope every one of you had an amazing lunch and you had also coffee, because we do not want you to fall asleep throughout the next 1.5 hours. And I'm really looking forward for the next 1.5 hours where we're going to present amazing scientific results paired with the clinical treatments. And then, of course, we'll show you how patient testimonies look like and how, of course, the clinical outcome can be combined and paired with the most optimal rheology. We're going to do this in collaboration with Filmed, and for this, I would like to show you a little bit about this company, which we're going to see right now. So, that was a nice jingle, right? Now everybody is aware and awake. So, this symposium will be, of course, not held exclusively by myself or Max, who is here as well. Most of you know Max, but I'm going to have amazing faculty here with me. And I would like to introduce this faculty, and I would like to ask the faculty to come on stage. First, I would like to introduce Dr. Nicholas Möllhoff, plastic surgeon from Germany. Please come on the stage. I would like to introduce Professor Alessio Radelli, vascular surgeon and anesthetic from Italy. I would like to introduce Dr. Freya Alfagnan, dermatologist from France. Welcome, my dear. I would like to introduce Dr. Konstantin Frank, plastic surgeon from Spain. And Dr. Sandrine Sabon, also aesthetic doctor from France. Please join me on stage, guys. The wonderful Sandrine. And because we had that session already, I would also like to introduce Dr. Lina Good, aesthetic surgeon from the UK. Please, my dear, come on stage. Amazing. So, guys, this here will be my amazing faculty for today. I would like, please have a seat. I didn't tell them where to sit. Now we need to see what they're going to do. So, what we're going to do today, it's a little bit different from the usual symposium, because what we're going to do is we're going to try to present to you the science behind the aesthetic treatments. And normally how it is in the aesthetic field, there's an aesthetic trend, and then the science, alongside with the anatomy, is running behind it to explain why it works. You know this very well, very frequently. You get a treatment, the outcome, and then you ask, oh, but why does it work? But today we're going to turn it around. Today we're going to talk first about the respective treatments and how it works with the underlying anatomy. So this is going to be the agenda. We're going to have 3 major components. We're going to talk about lifting, we're going to about shaping, and about smoothing. And why did we choose that? Because in the past it was always considered the only solution to achieve superior aesthetic outcomes was with volumizing. But we're going to change that, because we're going to start somewhere in the lateral phase, we're going to start in the upper phase, we're going to respect aesthetic principles when it comes, and this is why we're going to start first with the lifting, and then with shaping, and then with the smoothing. It's very similar like you build a cake. You start with the foundation, and then you add on top until you refine the surface. So without further ado, I would like to invite the first speaker, Dr. Nicholas Möllhoff, who's going to talk something about the lifting. My dear.
Thank you, Sebastian. Thank you for the introduction, and a warm welcome to all of you also from my side. I have the honor on speaking to you about the first anatomical concept today, and that is going to be the anatomical concept behind lifting. Now, we're going to go straight dive deep into that, but before we speak about the anatomical concept behind lifting, I would like to remind you of one of the principal and on one of the foundations of facial anatomy, which is the layered arrangement of the face. I'm sure most of you are already aware of this, but I'd just like to bring us all onto the same page. So, when we think about the face, we need to understand that there is something deep to the skin. And this something deep to the skin is arranged in layers. And all due respect, Sebastian, what a beautiful dissection here. I think we can all appreciate the fantastic layered arrangement that extends from the upper through the middle and down to the lower face, irrespective of the facial region that we're looking at. Now, generally speaking, we have a general concept of the layered arrangement, and that includes 5 layers. We have regional exceptions to this, but in general, we speak of 5 layers in the face, and those include most superficially the skin, followed by our superficial fat located within our subdermal superficial plane. We have our superficial muscular aponeurotic system in layer 3, followed by deep fat and deep compartments in layer 4, and our deep fascia and periosteum in layer 5. Now, the consequence of this layered arrangement is that you need to regard the face not just as individual facial regions, but you need to appreciate that they're actually all interconnected with each other. And what that means for our treatments in practice is that a treatment of the upper face will ultimately affect our middle and also our lower face. Now, these facial layers, they're not just thrown on top of the face, no. They're attached to the fundament of the face, which is the bone, by facial ligaments. And you can really see in this nice subsmass dissection that these ligaments fix our mobile fascias and our mobile tissues in their layered arrangement onto the fundament of the bone at strategic points. Now, when we connect the surface projection of the most important ligaments, and I'm sure that many of you heard of this concept before, we connect the line of the temporal ligamentous adhesion, the lateral orbital thickening around the orbit, the zygomatic ligament, and the mandibular ligament, represented by the dotted line that you can see, the red dotted line. That forms the line of ligaments. Now, the line of ligaments basically separates the face into a medial and into a lateral part. And based on the fact that we have layers that are located beneath the skin, and that these layers are continuous with each other and connect basically from the upper to the middle to the lower face, we can deduce a couple of aesthetic principles, and I'll be talking about 2 of these today to you, and Konstantin will refer to the 3rd principle in his presentation later on. So the first aesthetic principle that I would like to discuss with you is the lateral face first principle. And the lateral face first principle utilizes the line of ligaments that we just got to see before, and shows that injections lateral to this line of ligaments actually precondition and influence the injections that we do in our medial face. And there's actually a beautiful split face study which analyzed midfacial volumization utilizing the same injection techniques, the same injection points, and the same injection volume, just targeting these points in a different sequence. So on one side of the face, lateral face first injections, and on the other side of the face, medial face first injections. And what this study showed was really interesting, because when analyzing the volume required to achieve an aesthetically pleasing and a symmetrical effect on both sides, the study showed that if you inject lateral first, you require less volume of your soft tissue filler product, which basically means that lateral injections first are more efficient when it comes to the milliliters that you need to put into the face of your patient to achieve a similar result that you would if you treated the medial face first. And that's based basically on the layered arrangement of the face, because lateral to the line of ligaments we see parallel layers, and injecting into these layers basically stretches the tissue slightly and can exert to a certain extent a slight pull on the tissue and precondition and prime for our injections that we perform in the medial face. That concludes the first principle. I told you we're going to discuss 2. So the second one is the upper face first principle, and it relies on a similar principle and the underlying anatomy, of course, and it shows that injecting in our upper face first repositions and primes and targets our lower facial layers as well, located in our middle and in our lower face. Now, there was a similar study that investigated, again, the same injection points, the same injection volume, and the same injection technique in a split face model, just injecting again in a different sequence, so either upper face first or lower face first. And again, we found interesting results in that we analyzed mid-facial volume, and there were raters who rated mid-facial volume, as well as objective 3D volumetric assessments which analyzed mid-facial volume. And both parameters actually showed improved results for the upper face first technique. So for mid-facial volume analysis, a higher bar graph, the blue bar, represents an improved result for the aesthetic appearance of the mid-face using the upper face first algorithm. And for the rated mid-facial volume, actually a lower bar represents an improved outcome in mid-facial volume. Now, we also asked independent observers to analyze mid-facial volume on the Global Aesthetic Improvement Scale. And that showed, again, that for the upper face first sequence and for the upper face first algorithm, we saw improved results compared to the lower face first algorithm. So we need to put this into perspective, right? We need to think of how does this affect our treatments in our clinical practice. And one region that comes to mind, and the video is already playing, is obviously the temple, because it's located in the upper and in the lateral face. Now, I'm just going to go back quickly because that played a little bit too fast. I'm going to tell you this. The temple actually has 13 layers. And we want to look at the anatomy in a little bit more detail, but I'm not going to focus on all of those layers. We're just going to take a step back and look at the most important ones. So we reflect the skin, and beneath the fat, what we see is the superficial temporal fascia, and that includes the superficial temporal artery. Now, beneath the superficial temporal fascia, we have our interfacial plane, which lies between the superficial and the deep temporal fascia, which is being reflected here. Now, as we deflect the deep temporal fascia, what we see is two structures that are extremely relevant for volumization of the temple, and that is the extension of the fat body of Bichat, which is going to be picked up by the forceps now, and beneath that, the temporalis muscle. So going back, you need to think, applying these principles, what's the region that makes sense in a full face approach to target first? And as I said, in the upper face and in the lateral face, there's actually only one region that is located exactly here, and that is the temple. So that is why we're going to focus on this a little bit more. It has been shown in a study that subdermal injections of the temple on top of the superficial fascia, on top of the superficial temporal fascia within the subcutaneous plane, can actually not only lead to volumizing effects of the temple, but to a certain extent also cause a repositioning of structures that are located in the lower face. And this technique, or this special treatment, was termed as the temporal lifting technique. Many of you have probably heard of it. An insertion point anterior to the tragus, cannula advancement in the subcutaneous plane behind the hairline, and a bolus injection in that respective area leads to, and this study revealed that, to a contouring of the jawline, and to a certain extent also to a redistribution of midfacial volume. And this applies basically to both of the principles that we just saw before, the upper face and the lateral face principle. Now, these techniques were not only shown in the temple, but an independent study actually investigated subdermal superficial injections both in the temple or in the jawline, and found that irrespective of the area of location, the more superficial the treatment was in the subcutaneous plane, the more repositioning was achieved. Now, for deep injections, and this holds true especially for the temple, so deep injections into the temporal fossa with a needle contact to the periosteum and a bolus injection causes much more localized volumizing effects rather than redistribution of caudally located tissues. And especially when it comes to the temple, you need to remember that the deeper you go, the more localized your results will be, and the more superficial you go, the more redistribution you will be able to achieve. And that concludes the first part of anatomy, and I know that we're going to see some fabulous injections by Alessio before. I will hand back to Sebastian, and looking forward to what's to come. Thank you very much.
Thank you very much, Nicolas. I think you've seen that there are principles, there's scientific evidence how we can structure treatments. We can start in the upper phase first, we can start in the lateral phase first, and the deeper we go, the more localized the treatments are, the more superficial we go, the more regional the treatments are. But to put this into perspective, now my dear friend Alessio will show you how he does it with his magic hands. Alessio, please.
Thank you. Thank you. Thank you so much. And we saw how important is, as always, anatomy. And we focus our injections on anatomy. And then always we have to translate the anatomical knowledge in clinical treatment. And I did a treatment a few days ago, and here you see the results that I had. Because sagging is an important trend. Many patients after 30s, 40s complain about this problem, and how to solve this is really crucial. So you see in this study that we know very well that from the 40s until the 60s, 75, because today a 75 man or lady is young. And so you see that until 40% can complain about this and want to try to solve this problem. And this is the lady that I treated. That is an incredible good indication. As always, we know that the indication is important. If we get a good patient, we get incredible results. If the patient is not so perfect, is not so good, the result. So here, what she wanted.
Alors, je me prénomme Stéphanie, j'ai 48 ans. J'aime pas spécialement une partie de mon visage, je m'apprécie... Enfin, j'assume ce que je suis entièrement. Au fur et à mesure des années, forcément, on voit les rides s'installer. Les pommettes, au fur et à mesure des années, je les avais ici à 20 ans, forcément. 30, 40, et là, 50. Donc, si on peut aider à ce que ça reste un peu en haut, tout en restant naturel, évidemment, pourquoi pas?
So, lifting. This is what she wants. And I wanted to underline the tissues that she had, because also this is very important, the rheology, not only of the fillers that we have, but also of the tissues. And then we will have the speech of Ferial, that is an expert in this. So, domino effect. I injected first temples, both laterally and medial, then the lateral mid-face, that also is important, but then in this patient it was not sufficient, and I injected to conclude this holistic approach to the face, also the jawline, and finally also improved a lot, but I wanted to improve also the nasolabial fold. Which product? Of course, we need a high G' product, elastic, with very low rate BDDE, so not aggressive. I never had in my experience problems, with very long chains, so very long lasting, but moldable. And with a light more quantity, 1.2 ml, that when you use 2 or 3 vials means to use maybe 1 vial less. We saw what Nicolas and Sebastian told us the line of ligaments, I injected laterally to this step 1 temporal lift, step 2 zygomatic, step 3 jawline, and then maybe also the perioral area, because the technique must be well concluded. So this is the sequence that you see. First, a bolus around 0.6 ml in the temples laterally to the hairline. Then a fan technique medially to the hairline. Then the second step is the treatment of the zygomatic area, both with cannula, but also with a deep bolus technique, and also laterally is fundamental, but sometimes in this lady I injected also a little bit medially to the ligaments line. And finally, as I told you, I concluded the treatment with a light quantity. You will see 0.3 ml for all the jawline, that if you inject the jawline, know that it is nothing at all. And so you get a lighter mandible. She wanted a lifting, not a volumization. And with this, you inject less product. That is our goal. And finally, also the nasolabial folds, because I wanted to conclude this. Here you see, so the treatment according to the different steps. You see, here I entered just in front of the tragus. I use a 23 gauge needle, and I did the entry point. The cannula is a 22 gauge cannula. In this case for 50, because it is a little bit less flexible and I prefer. You see, this is, I am in the subcutaneous tissue, and I prefer to do many channels, not only 3 or 4, because then you have some waves that I hate. And so you see many channels. In the subcutaneous tissue we are over. We saw the temporal artery, and so very safe, quite never have. You see also this part anteriorly, immediately lateral to the orbital bone. You see here the treatment of the zygomatic area that I do medially, but mainly laterally, and also here over the ear, because this little detail is, in my opinion, very important. The same entry point, you go laterally without, and also in this peri-auricular area is very important. You see, I arrive also where I injected my bolus. And finally, for zygomatic part, the deep bolus, I prefer to do an aspiration test. How much? Normally I say for each point from 0.2, 0.3, but it is of course according. And you see here 0.3 ml that I used, and you see the result immediately that you have, that using, of course, volume will be a very long lasting. I saw this, and the zygomatic part is wonderful. But then you see the cheeks, nasolabial, maybe you have. And so I used Universal, that has a perfect rheology, with a 22 gauge cannula, the BioNutriLift cannula. And I did this light subcision for nasolabial, releasing the superficial tissues, and also on this part to uniform a bit the result. Well, this is the treatment, quite everything with cannula. No bruise, of course, no swelling, nothing at all. These products have a very low swelling ratio, so quite never I get a problem of swelling. And finally, a light massage. So the injection technique is done universal for nasolabial folds, volume for temples, zygomatic area, and jawline. And these are the quantities that I used. You see, per side, 2 vials, so 2.4 around half normal syringe, 2.4 ml for 2 vials of volume, and 1 vial divided on right and left nasolabial, more superficially and for the perioral area. And this is the result. So here is the lady before and after. First, immediately you see the naturality of the result. I used 5 vials totally, so the naturality of the results. And here you see the possibility to have an immediate result. Then, in next Congress, Imcas Congress, I will show you after 1 year, maybe, if we can. And the result of the eyebrow, that is, of course, impressive, but also take a look of the zygomatic part, that is slightly volumized, but lifted a lot. Here, before and after in 45, also the superior eyelid that changes. The inferior eyelid that you can see, the lateral zygomatic never, we check so beautifully, but honestly is an interesting result. And so that's it. This was my patient. I show it. Back to you, Sebastian.
Thank you very much, Alessio. Guys, I hope you've seen how from science you can bring this to the patient, how the patient can benefit from the science, because there's evidence and you just translate the science into clinical practice. But you've seen the injection technique, but what is also most important, you need to know which type of product are you using. You need to understand the underlying rheology. And for this, Ferial will give us more information about this respective topic.
Thank you. Thank you, Sebastian. Thank you, everybody. So the things that is important is all of the data that you have for choosing the products, as Sebastian mentioned, it is based on the evidences and how we decided to put these two types of products for these types of approach. So here is the results of the study. It is a preliminary result of the study that we have done for the tissue rheology with supervision of the Sebastian, also for measuring different parameters and different parts of the face that you can inject inside. It means that 15 different zones of the face that you can inject inside. So as you can see, I have chosen only the zones that we injected and Alessio injected in these types of approach. So for giving you data, look at the red line in this graph. The red line is the firmness of the skin, the parameters of firmness of the skin measured by cutometer. And as you can see, if the data is lower, it means that the skin is more firm. So as you can see here, the nose for this data, the red line, is the most firm and firmest points of the face. And as you can see, the tear trough, it was the loosest zone. And as you can see, these 3 zones that Alessio injected inside, the temple, the cheekbone, and also the jawline, it was the middle. So they are the middle, they are not very, very loose, and they are not very, very firm. And they are in the middle part of this curve. And the R8, because these 2 parameters is the Q0 and also R8 parameters, because many, many parameters in Q-meters, they are more important parameters. And you can see here that it's confirmed by it. The last one, it is the violet, rectangle in this schema, show you the nasolabial fold. The nasolabial fold is a little looser than the other sides, so we need, as you can see, we don't need the very, very dense product. So this is another machine that measured without any contact with the skin. It is the same method that you can measure the pressure of the eyes. And so this is non-contact. The name is the underskin. And as you can see here, exactly the same things. The viscoelastic parameters of the skin is confirmed in a temple, in the cheekbone, and also in the lateral cheek, and with jawline. This is the same thing. So it means that they are the firm part of the face. So we can also measure the skin thickness in different layers of the skin. As you can see, the thickness in the stratum corneum, we can measure with the very, very new device, LCOCT device. This is something between optical tomography and also with confocal microscopy. So here you can see that according to the skin thickness for stratum corneum, epidermis, dermis, and also the hypodermis, you can see the different data. It means that the thickness in these zones for the hypodermis is higher than the other zones, but for example, the epidermis is lower. So according to this, when we finish the tissue rheology, this another article published by a team of Sebastian, they show that the spreading of the products according to this G prime is different in different parts of the space and body. And as you can see, for example, for a scalp, when we use the lower G prime products, is spread more, and when you use the higher, is spread less. So for these types of lifting method, we need more G prime products, but not very, very high. So as you mentioned, as you can see in different zones, and here, as you can see, for temple, mid-face, and jawline, we need a high G prime, high cohesivity, easy to inject, good aesthetic results without any, irregularity. And for nasolabial fold, a moderate G prime and high cohesivity, easy to inject also, and good aesthetic results. And as you can see in this table, comparing all of the previous published products with the G prime and the G double prime, you can see here the art filler volume that is 400, and for the art filler universal is around 200. So they are very, very adapted to this area. So I come back to Sebastian for the other part.
Thank you very much, Ferial, for enlightening us always in this incredibly complicated topic, rheology. Sometimes I even have problems saying that. It's really difficult sometimes, right? But she understands it, and she can guide our journey to understand which product for which area. So now that we have understood that the patient wants maybe just a little bit, still natural, still nice, a little bit just repositioning, just a little bit of lifting. We covered that area with the principles, upper face first, lateral face first. But what are we going to do next? Sometimes the patient just needs shaping, just needs volumizing. And for this, we need to cover other topics and other aesthetic principles. And those will be covered by my dear friend, Konstantin. Take it away, my dear.
Thank you so much, Sebastian. Welcome also from my side to this film at Symposium. So I have an easier word to speak about, not rheology, but rather shaping. And we will circle back to some concepts that have been introduced to you by Nicholas in the previous talk and try to adapt them to another technique to shape your patient. So we know about treating the upper face first. We also know about treating the lateral first. But the third principle that we need to incorporate into our treatment schemes is injecting deep first. In the next couple of minutes, we'll link the idea of this third aesthetic principle to the idea of shaping your patient. Now, you are aware, at least by now after this session, probably you've known that before, that of course we have different layers in our face that make up the entire structure of the face. Now, Nicholas told you that we do have a line of ligament which basically separates our lateral face from our medial face. And he also told you that those layers can influence other regions when you inject them. However, what he didn't disclose to you, and this is what I'm going to do now, is that there are actually differences in the layered arrangement of your face between the lateral and the medial midface. Now, when we look at the layered arrangement in our lateral face, we could already see this in the dissection video by Nicholas and Sebastian just before, we have all those layers on top of each other, which ultimately gives a parallel arrangement. And this is really important for two reasons. The first reason is that with increasing age, the pull of gravity on those layers kind of shifts down our tissue. And this is only possible because those layers are actually arranged in a parallel manner. If they would intersect with each other, no gliding would be possible. And on the other hand, and this is where the clinical part comes in, we need some gliding surfaces to actually reposition something, as we have just seen with the lifting technique. Now, once we pass this line of ligaments and go more medial, we will lose our parallel arrangement. And from an anatomical point of view, this is something not so pleasant because it gets much harder to dissect right there because those layers are then intersecting with each other. And the reason for this is because the muscles need to travel superficially to actually insert into our skin to allow verbal and nonverbal communication. What results out of this oblique arrangement is a higher projection capacity once you inject soft tissue fillers. Now, both the superficial and the deep fatty layer are made up of compartments. And those compartments are bordered by so-called retinaculate cutis in the superficial layer and by actually morphologically visible structures in the deeper layer. And in 2007, Val Lambros was the first one to introduce the fatty deflation theory. And he actually introduced this concept by telling us that with increasing age, we lose volume in our compartments and they kind of become empty. Just like those grapes you can see here. When you leave them out in the sun for a couple of weeks, they shrivel down, they shrink down. So what we do is inject soft tissue fillers to give back volume. But also keep in mind that by giving back the volume, we are providing support for all overlaying structures because they rely on the support of these fat compartments. And namely, those fat compartments in the superficial fatty layer are the nasolabial fat compartment, the superficial medial, middle, and lateral cheek fat compartment, and of course, our jowl fat compartment. Now, if we do go down one layer more, we will see our deep fat compartments. And the deep fat compartments are namely, I think this is the most prominent one that most of you know, the SUV, the suborbicularis oculi fat pad, our deep medial, deep lateral cheek fat compartment, and of course the deep piriform and deep nasolabial fat compartment. So now, why does it really become important to inject deep when we want to shape? Well, Leonie Schalke and her research team conducted a recent study which investigated the mobility of those fat compartments. Because you have to imagine that once you start moving your face, as I'm just doing in this moment while talking to you, while expressing emotions, we are also probably moving the tissues in our face, right? Otherwise we couldn't see it. So what she did was measure the actual extent of movement for both the superficial and the deep fat compartments. And I think it is really clearly right here in those bar graphs that only the superficial fat compartments are actually moving in both the mid-pupillary and also the lateral canthal line. So if we add volume in the deep layer, we are not actually interfering with the movement because those fat compartments are static anyway. However, if we go do superficial and inject superficial, we are kind of altering and alternating the biomechanics of the face. So keep this in mind. This is one of the reasons why deep injections are so important. And now we'll have a quick look at the actual anatomy of the midface to give you some guidance when we go over to the clinical part. And once we deflect the skin, we can see the superficial fat and the orbicularis oculi muscle. Now, what is so fascinating about the skin right here in the infraorbital region is that it is the thinnest you can find in the body. Right here, we're pushing the forceps against it, and you can read what's written on the forceps. It's that thin. Now below we have the superficial nasolabial and malar fat pad, and if we flip this over, we're actually able to see, for once, the facial vein which crosses through the entire midface, and right here, the levator labii superioris alequinasi muscle. At the same time, we see that in the medial aspect, there's actually no fat below the muscle, but rather only bone. However, if we now go lateral towards the area where we have to expect our SOOF below, as its name says, the orbicularis oculi muscle, we can see that the zygomaticocutaneous ligament and orbicularis retaining ligament are actually kind of encompassing the suborbicularis oculi fat pad. And when we push between those two ligaments and flip over our orbicularis oculi again, you can see that they fuse, and they fuse into the tear trough ligament, which then moves up to the medial canthus, accompanied, of course, by the facial vein. So now if you flip over the levator labii superioris aliquinasi muscle, also called LL-SUN, which is much easier to pronounce, we can see the infraorbital artery. And the infraorbital artery has three branches, one going up to the lower eyelid, then one going over towards the dorsum of the nose, and of course a labial branch. So be aware that in the depth, even though we might need to give structure and support to the deep fat compartments, there are some vessels waiting for you. Now, I told you that injecting deep is important, and I already gave you a reason for this. The problem, I think, that is out there, and you hear often, is that people are afraid of having too little projection when they inject deep. They're afraid that their product will not exert the same effect. And we tried to find a method to actually objectify the effect of injecting a filler into the face, and that kind of introduced us, or made us create the surface volume coefficient. The surface volume coefficient actually tells you, by using three-dimensional surface imaging, how much of the product that you inject you actually see on the surface. So we injected different fat compartments in a study and then measured their surface volume coefficient. And surprisingly, you can see that the suborbicularis oculi fat pad has a surface volume coefficient of almost 0.92, right? So if you inject 1 milliliter of soft tissue filler, you get a projection and a volume effect of 1 milliliter, which is pretty good. So you almost get what you inject. Now, of course, you can see that in the deep medial and deep lateral cheek fat compartment, the surface volume coefficient is not that high, but still keep in mind that if you want to shape, and you will see this in a couple of minutes, beautifully done by my colleague Sandrine, don't be afraid that you will not get enough projection in this lateral part of the midface, because this study right here shows you, using objective data, that you do not need to be afraid of this. Now, one last thing before I will hand over and give the microphone back to Sebastian is that we really need to consider, if we are going to shape the midface, if we use a needle or a cannula. And I think it's one of those everlasting debates what to use. And when we compiled this set of slides for you, we're thinking about, okay, what's really important when it comes to shaping? And which part or which differentiation that you get with a needle and with a cannula is really important. And we decided to go with precision, because there is a big difference in terms of the spread of your product, and also then again, of course, the projection you get from a product if you inject with a needle or a cannula. And we conducted this study about 6 years ago, I think, but it's still really valid for the clinical part. And we injected using contrast-enhanced hyaluronic acid filler into 10 human body donors, and then measured the vertical and the horizontal extent of the product spread. And you can actually see here quite nicely that if you inject with a cannula, there is a lot of horizontal spread along the injection channel when you use a cannula, while there's not that much vertical spread of the product. The same was done injecting with a needle, and here you can see that there's not that much horizontal, but rather much more vertical spread. And putting this into numbers, you can see that those differences were actually significantly different. So if you use a cannula, you get a significantly higher horizontal spread, while if you use a needle, you get a significantly higher vertical spread of your product. And of course, when we want to shape, and you will see this in a couple of seconds, we want smooth surfaces. And with this, I will hand back to Sebastian, and are looking forward to see the clinical application of all those concepts. Thank you so much.
Thank you very much, Konstantin, for concluding actually the fact that we have 3 aesthetic principles, not only upper face, not only lateral face first, but also deep regions first. And what is also interesting is that in the beginning, Nicolas told you all of the layers in a face are parallel. And then Konstantin comes along and said, no, it's not true, because in the medial face is different than a lateral face. And with this influences also the aesthetic outcome. And when you target those regions, you also need to think about needles or cannula, because the precision is different. Now it really starts to get complicated, right? But Sandrine will tell us exactly how to do this and how to put all of this into perspective during her treatments. Sandrine, please, take it away.
Thank you, Sebastian. Yes, if we, of course, focus on our clinic aspect, we know that what is really important is to consider the science, as we saw, of course, the tools, like the cannulas or the needles, of course, the product, but we have to conserve in our mind the artistic and beauty criteria. I think that it's the third thing very important. But we have to consider the anatomy always, because when we are injecting in our practice, we have to inject, of course, male, females. We have to consider the injection on Asiatic people, on African people, or Caucasian people. So it's important to adapt our treatment, because we have not only a head or face just in front of us, but we have a person, and characteristic and features are very important to consider individually. So if we have a look on the skull of the male and females, you know that there is so much difference. And this is the support, this is the architecture of the face. So of course on male, we have a square face and rounded with the females, as you can see on this slide. The frontal bone flattening is homogeneous on males, and we can observe two lateral deep flattening on the forehead on females. The orbital rim are different too. The orbital rim on male are squarer than females, where we can find round orbital rim. And of course, the contour of the face is totally different, and our expectation when we are injecting our patients are not the same, because if we want to enhance the masculinity, we have to consider, of course, the mandibula differently on male and female. If we want to feminize a face, we will be very thin on a female and very large on a male to conserve this different shape of face. Square on male and triangular on females. Now let's have a look on the proportion of the deep fat and superficial fat. You know that there is difference too on males and females, because on male we have, of course, more distribution of fat quietly different, but the reduction is more important with aging. The fat is reducing in the deep compartment, and contrary to the woman, whereas superficial fat is gliding, on male it's reducing. The deep fat, as you know, I don't know if you know, but time is running, so you have to know that after 40 you lose 1 to 2% of fat, of deep fat. So be careful of your fat. And now you have a look, of course, we saw that on the mid-face of the male and the female. So if we have to consider the treatment with HA, we will focus mainly on the malar area with males, and mainly on the tear trough area on females. We will avoid to inject the zygomatic area on male, but mostly we will work on the zygomatic prominence on females. If we have a look on the lower face, of course we will focus mostly on the lips for females, and on the pointed chin we would like to reshape the face at the V shape for females, and of course we would like to enhance the mandibula and the chin area on male, like you see on this picture, to extend to the lateral commissure on male. And of course, you know that the products that we will use will not be the same if we consider the main mandibula and female. Now, I would like to show you my patient and a live demo on this patient. But of course, it's very important to have an interview with your patient before to listen his expectations, because of course it's a work together.
Je m'appelle James Kegan, donc j'ai 49 ans. La partie de mon visage que j'apprécie le plus, c'est mon regard. Et celle que j'aime le moins, c'est le sourire. Pas assez ouvert, pas assez communicatif. Donc le traitement va concerner le visage, principalement sur les parties de basse des pommettes et le long du cou, ce qui va redonner un peu plus de volume. Donc j'attends de ce traitement un résultat, une amélioration de l'apparence quelque part, et une qualité de peau un peu plus ferme et plus volumineuse.
So you see, we were talking together. He asked me to inject the jaw and the neck, and I did totally the opposite, because it was not what he was expected, but at the end he was so happy about the result. So I have used of course, art filler volume for injecting his mid-face. I used 23 gauge cannula in a very deep layer on the periosteum on the malar area. After I have injected the supraauricular region, as you saw just before, and after I had a second injection on the superficial layer on the zygomatic area. Of course, it was important to consider the whole lateral face at the beginning, because my goal was to lift my patient and look at this injection just around the ear and in the supraauricular area. I was, of course, injecting with one insertion point, as you can see here. And here I'm finding the good level to move my cannula and go vertically in order to enhance the mandibular angle, as you can see on this video. Of course, the two hands are working when we are injecting, as you can see there. Now the results with 6 ml, 3 ml each side. 3 ml, why? Because I have injected all the periauricular area, the mandibular area, and the chin area. And it was, you see, very natural. The expectation from French patients are very going to natural results. Of course, you can see the enhancement of the mandibular angle, the horizontal branch of the mandibular, and here you can see the repartition of the filler. Thank you for your attention, and go back to Sebastian. Thank you.
No. This one. Thank you very much, Sandrine. I think you've seen you can combine all of these techniques into one treatment. You design a treatment plan, and I think what Sandrine pointed out very nicely is talk to the patient. Ask the patient, what do you want? What do you need? And when the patient then identifies, well, I like this, but I don't like this, respect that. But how can you work? You know the knowledge, you know the scientific component, you know what the patient wants, and you know your injection techniques, but you still need to incorporate the rheology into your treatment plan. And for the shaping component, Ferial will tell us again how to utilize best the rheology for this treatment product.
Yes, Sebastian. Thank you so much. So I'm again here, but now you can understand that with my first explanation, it is more comprehensible for you, because it is easy to do this approach, the rheological of the rheology of the tissue and also rheology of the fillers. So both of them, they're important. So as you can see, I return to the same curves that you have seen before, but this time we focused on the mid face, and as you can see, exactly the same thing. So I repeat, because there are some friends that they join now this room. So with the measure of the firmness by cutometer, so we have the firmest part in the nose and the loosest part in the tear trough according to the 15 different zones of the face, and mid face. as you can see, this is a little more close to the tear trough. So it is a little loose, so we need also a high G prime product to do. And as you can see, according to the thickness also, the most thickness of this area is for the hypodermis. So we know that, and because of this, we should concentrate is a deep injection, as my my dear friend mentioned, how we should inject in the deep part of this zone. And for the viscoelasticity, non-contact, exactly the same thing. You can see that the viscoelasticity parameters is lower, so it is you have the looser tissue here. And so for mid-face, it is easy. You should choose a high G prime product, high viscosity, high cohesivity, because we want the product to stay in the same place that you inject, not fragmentational also, and not moving an immigration, and easy to inject because it's very difficult and dense. You cannot inject it and conduct it to the tissue, and good aesthetic results. So I go back to Sebastian.
Thank you very much.
You're welcome.
So far you've seen a lot of principles, a lot of anatomy about this respective area, but we talked in general, right, about what's below the skin. There is fat, there's muscles, all of these components, but how do they actually translate into the appearance of the skin? How does actually a fat or a muscle influence the overlying skin? How does this result in smoothing of that respective area? Well, for this, we need to think again about the layers, right? I know I mentioned this a couple of times, even yesterday, and a couple of times I mentioned this, Konstantin, Nicolas, we always mention layers, but actually that's not the whole story. That's absolutely not the whole story. And the truth is, because something happens below the skin. So if you look at this slide here, you can clearly see that below the skin, there's a network, a three-dimensional network of connective tissue. These are these retinacula cutis here. If you follow my red cursor here around this area, this is the retinacula cutis. So that means the layers below the skin are connected with connective tissue fibers to the overlying dermis. So what happens when below movement occurs? The movement is being translated to the skin. What happens if this movement constantly and all the time occurs during smiling, during other facial expression? At some point, the skin will break in, will give in, and then we have a wrinkle. Starting with a dynamic wrinkle, which you can only see when you smile, at some point you end up with static wrinkles. So this is the regular transition form, because at some point it just can't stand all of the stress that you put on the skin. So look at this video. I did a deep pinch into the soft tissues of this respective area, and this is an ultrasound image of the entire soft tissue thickness. So what happened is, when I pinched the deep skin, you can see how the connective tissue fibers, how they change. And with the change of these retinacula cutis, we also have a sudden change in the overlying skin appearance. You can imagine, if this occurs over time and time, this results in an aged appearance of the overlying skin. And I think this is important to understand that, yes, we do have layers, but these layers are all connected with each other. They all interact with each other, and the magic protein that does that is collagen, which we need to understand. So this is one of the dissections that I performed a couple of years ago, and what I did in this dissection is, well, I do not want to tell you how I removed the fat from that area, because I had to use a lot of kitchen utensils to do that, but I was able to remove the fat and just leave the connective tissue. So look how highly organized it is below the skin. It's not just skin, finish, fat, finish. No, it's not. It's highly organized, because the fat and the fat lobules, they need structure, they need support, they need guidance. And this is done by a connective tissue three-dimensional network. That is also sometimes referred to as the superficial fascial system. And we, of course, not the first ones to ever describe this, but it was described a long time ago, and the name was referred to as the superficial fascial system, which determines that there is a biomechanical unit between the layers below the skin, the three-dimensional connective tissue architecture, and the overlying dermis. All of them are acting together, which ultimately influence the appearance and the smoothness of the overlying skin. And you can see this here, some histological staining, how all of these connective tissue fibers, they attach to the overlying dermis and they influence the overlying dermis. So we just recently asked ourselves, when we look at the face, which region of the face makes a face look old? So which of all of the various different facial regions contribute to the appearance of a mature face, of an old face? Which are the regions? So what we did an eye tracking analysis. It's a very interesting methodology, and Konstantin is the expert in doing that, because you show a picture to the study participant and a camera captures the eyes, in which direction the eyes are moving. And depending on how long someone is looking at various facial regions, then you can say, oh, that region attracted the attention of the observer. What is very interestingly is, if a region immediately or longer attracts the attention, the observer thinks that that region is not pretty. I know it's a little bit weird, right? Why is that? So that means if something is pretty, if something is amazing, you just look at it, check the box, continue. It's fine. But if you don't like something, if something is off, you always look at it, what is this? What is this? And the reason why your brain is doing that is it needs visual input. It needs information. Because the blueprint that we have of beauty in ourselves does not match with what we see. Because what we see might not be pretty, but we expect it to be pretty and it doesn't match. And this is why we need a lot of input, visual information to adjust, to understand what we are seeing. So this is eye tracking analysis. And we found out actually the reasons that most contribute to an aged facial appearance is the periorbital region and the perioral region. Perioral region ranked #1 and the periorbital region ranked #2. So these are the two regions that contribute to an aged facial appearance. So it's really important to understand that areas. So what happens in the periorbital region? Well, in the periorbital region, we told you that there are 5 layers. It's actually not true. I know you might be disappointed. You say, oh, Kutufana, you always tell us different things, right? First 5 layers and then it's not true. Yeah, I'm sorry. Because in a tear trough, we have 3 layers. In the area where we have the palpebromalar groove, in the area of the soothe, there we have 7 layers. No, in between we do not have 6, it's just 3 and 7. We just need to understand it's totally different. And because the skin, especially medially, is very thin, as in the video Konstantin showed you, it's the thinnest that we have in a human body. Less than 1 millimeter thickness we have in that respective area. Of course you can have skin surface irregularities, because the underlying 3-dimensional connective tissue network, it allows for those components. So you need to understand that there is an area, because of the underlying anatomy, it influences how it looks. And that is the periorbital region. That's as region #1. And the other region is the perioral region. And the perioral region is very interestingly, because especially in the perioral region, you have a lot of muscles, many of them. I know every one of you is familiar with each name of those muscles, and this is why I will not quiz you on it, because I know all of you know the names and especially how they are arranged. But why did Mother Nature design so many muscles in such a small area? We have so many muscles. The reason is we need to control the skin. We need to have a proper interaction between the muscles and the skin. First of all, while we speak. I mean, when I'm moving my lips, a bunch of muscles all the time have to move and have to interact and have to coordinate the overlying skin. And in addition to this, apart from speaking, chewing, swallowing, eating, all of these things, they have to move the skin. And because the muscles have to be connected to the skin, there's a very different subcutaneous arrangement. The connective tissue, the so-called superficial fascial system that is below the skin in that respective area, that is very elaborated, influence what is on top. However, now that we understand perioral and periorbital area and the skin of those respective areas influence each other, we need to understand how to treat, how to address this. And this is now explained by Uliana, my dear. Please take it away.
Thank you, dear Sebastian. And I have to say, Don't we all think Sebastian has beautifully smooth skin? You're going to have to tell us your secrets later on. Okay, guys. So we've spoken about the 3 key concepts: shaping, lifting, and now smoothing. For those of you who know me, I'm hugely passionate about skin quality. In 2014, we wrote a book with my friends around the world on resurfacing with chemical peeling and skincare. But what we now know today is the beauty of the FilmMed technology, particularly the word which is sometimes known as mesotherapy. Can I just get a show of hands? Who here uses the non-cross-linked fillers with the FilmMed range? Lift your arms up. Let me see. Okay, excellent. So I want to share with you some of my experiences because we can now smooth, hydrate, and give that important universal beauty metric. So if you're on Instagram, please do join me. It's a pleasure to connect. I'm going to show you a quick picture, if it comes up. Let's have a look. Let's have a look again. There we go. There we are. There we are. This is my lovely patient. Her name is Sky. She's approaching 40 years of age. Can you see she's holding an iPad? Can you see this picture here? This is her 5 years ago when she started to see me. And what we've done, you can see what we've done, is shaping and lifting, right? But no matter what your age, what your gender, what your ethnic background, we all need smoother skin. It's a universal beauty metric, a bit like clarity, right? And so this has been taken 2 years ago, okay? Even through the years of COVID, which have been very stressful for our skin, we can see there's improvement. And this is last week. During the last 2 years, I coined a word which we went to the beauty press with. And that word was skin-anxiety. Skin anxiety, skin-anxiety, is a concept that many of us may have felt in the last few years with the phenomena of Zoom face, maskne. Who has experienced a slightly increased level of anxiety about how their skin looks? I'm going to lift my hand because it's true. We've all had a little bit more pressure, right, in the world of COVID. This is where smoothness comes in because it is that universal beauty metric. I'm going to show you her testimonial. So this is Sky. She's 39, turning 40 in a few months.
Hi, my name's Sky. I'm 39 years of age, and after the last 5 years, I've been working with a fantastic Dr. Goot, really working on lifting and shaping the face. The results I am over the moon about. Just a couple of photos of before and after, which I've been working with Dr. Goot on, like I said, over the last 5 years, and I've seen a fantastic difference. I'm over the moon about what we've achieved. And now, over the last 2 years, what we've been working on is smoothing. I'm a communicator, I work in the communications industry, and over the last 2 years, especially over the pandemic and using Zoom, I've really felt conscious about my skin and about my face and the effects that the last few years have done. So I'm super excited to see the effects of the smoothing. We've really worked on the eyes and the mouth, which I feel are super important. And I don't want people picking parts or being able to see the crepey skin that is starting to take effect. So with the sun damage and the effects of pollution and everything else, our daily lives, the effect our daily life have on us, we are now moving the smoothing higher up. And what I feel is super important for people my age going into their 40s and should absolutely be a point of conversation in our early 20s is prevention. I really feel this is a key part of what we all should be taking note of, what we should be doing then to then prevent the effects of aging, of sun damage and pollution and all the other effects onto our skin as we go into our 30s. And now I'm going into my 40s, what I can learn to help preventing and stop any more progression in certain areas into my 40s, 50s and 60s.
Brilliant. So take a look at Sky. Let's get her moving. Look at her skin quality. There are some shadows. She is from the UK. She's from London. She does not want too much. It's just that look. In London, sometimes people want a little bit. They like some lines. They like some shadows. She can have more improvements with shaping and filling. We know that's the case. But let's have a look at her skin. And these are the 3 products that I use for most of my patients on one sitting. So I combine 3 of them. NCTF 135HA, I love. MHA 10, a bit more integrity. And this is fine lines. In the syringe, you can also use universal. 3-in-1 for smoothing. This is a quick video to show you the properties of these products. You can see on the left, you've got your NCTF. It's very, very smooth and fluid, full of vitamins, peptides, amino acids, plus your non-cross-linked hyaluronic. In the middle, you see your MHA 10 milligrams of hyaluronic, non-cross-linked. And to the right, you've got your fine lines. Beautiful product. So this is the injection technique. Take a picture. There is no right, there is no wrong when it comes to treating skin. You treat whatever areas you want to satisfy your patients. But there is one thing that I do, and I know Sebastian and I talked about this. When I examine skin, I squash this skin. I squash it and I watch it move. Because when you squash skin, you see early onset future dynamic static lines, right? So you'll see me in a moment when I do my injection, squashing, injecting, flexing, injecting. So I'm following what the future will show. So here, as you can see, I use short needles. So I use 32 gauge, 4 millimeter in the pack, 30 gauge, and these beautiful NanoSoft. If you haven't tried NanoSoft, they are phenomenal. Really worth investing. Try it, guys. I don't have to say anything more. Then, of course, you've got your MHA 10 here, which is in green, and this is your universal, or you can use fine lines. So take a photo. You can read it at home later on. But this is what we want to see today, the videos. I'm using NCTF 135HA. I love this product. I talk about feeding the skin, driving nutrients into your skin. We can all benefit regardless of age, gender, or ethnic background. You can do retrograde threads, very small injections. I probably do in a face around 200 injections per sitting. And some of us might go, my God, that's a lot. But actually, the way the needles are designed in the packs make it pretty much flawless. So just change the needles quite often. This is your NanoSoft. You saw me stamping with a NanoSoft. And this is MHA 10 around the lips. This is just to show you the volumes I use. I don't put too much. And I use it around the lips for people who don't want lip fillers. So I give the lip gloss, which Phil Med was talking about yesterday, the lip gloss technique around the lips, just to plump, just to hydrate, to bring the radiance back into the skin. So the patient's quite comfortable. She actually hasn't got any anesthesia, by the way. She doesn't want to, and that's absolutely fine. So you can see with these products, these needles that are provided in the packs are beautiful, and I would recommend you try them. So here I'm going around the vermilion border to give her the lip gloss, which if you came yesterday to the PhilMed Symposium, you would have seen that as well. So what I'm going to do now is we're going to move on to the neck, because for me, finishing at the face sometimes doesn't give you the full look. And of course, here I'm showing the nasolabial. Alessio talked about the importance of putting a little bit of support around that area, and here I'm putting a little bit of injections just where I see the tissues begin to crease up. Cannula, you can use universal here just to give support to the nasolabial. And you see, I always squash the skin. This is the NanoSoft with MHA 10, and I also use it with the NCTF. Beautiful injections, really easy, really simple, okay? Right, neck. I squash the skin, and here I'm delivering MHA 10, and you can do it nice and quick, okay? I put 0.001, I mean literally very little volume. You can do larger microboluses, up to you. It's a question of how you feel about the patient going home or to work. This patient always has a meeting after treatment, so I put smaller so it doesn't look so obvious in her meetings, okay? So this is the 32 gauge 4 millimeter needle. And this is putting MHA 10. I like this product inside. So you can see I can raise a larger bleb if I need to, and I just trace. I trace around the whole neck area. Please get your patients to flex the neck lift it. And every time you do it, you're seeing where the contractions are. So you're chasing the contractions. Now, I'm going to tell you it's very important to treat the platysma with your muscle relaxants. Very, very important to combine these two together. So I'm just going to show you her post-treatment. Yes, on the neck you can see a little bit of movement here. So let's play that video. She's moving around. You can see the blebs on the neck, but actually around the face, we've done almost 200 injections. She looks normal, right? She loves her neck being over-treated, and you can see I've been a bit overzealous. I haven't changed my needle, so she's got little micro hematomas, which is fine. She doesn't mind that at all, but you have to tell your patients that may happen. Just change your needles a bit more often. Okay, very quickly, just to show you the results after treatment, right? Beautiful. Almost 200 injections on the face. Beautiful results. The integrity of the skin, the smoothness, the hydration, the light reflex is kicking in, and you're going to get beautiful results in the next few months. Before and after, just to give you an idea, okay, because sometimes it's nice to see exactly what a patient looks after the treatment. There's a few more areas around through here, okay? And I'm just going to finish off with a little testimonial post-treatment.
Guy, 39 years of age. I am now back post-smoothing treatment with Dr. Goot. I am overwhelmed by the results. I couldn't be happier. I've had, after the shaping and sculpting, I am now back with the smoother lines, supple skin around my eyes, around my lips. I've had so many compliments. I'm absolutely over the moon. I feel everything is much smoother. My fine lines have gone, especially around my mouth. And I recommend this treatment to anybody of any age, in any profession. I honestly couldn't be happier. I think now the next stage is continuing with this treatment and the prevention and everything else post-treatment. And I'm sure you'll see from the results from the first time I saw Dr. Goot to now, the results are absolutely phenomenal. I am over the moon.
She's a good model, right? She's a fantastic model. So guys, look at this. Very quickly, 2 seconds, home care. You know I love skincare. If you haven't tried this product, I don't need to say anything. It's just good. That's all I'm going to say. If you like retinoids for collagen boosting, if you like to use hyaluronic, which I love in my skincare, and you've got some peptides, you've got some regenerating Wakami products in there, try it. I use it for maintenance of the results post-treatment. I love to use eye masks like this. This is high molecular weight polysaccharides. You've got some peptides in there as well post-treatment. People love to feel pampered. So pamper your patients when you do smoothing. So this is how
Dr. Goot has given me 2 products to use at home post-treatment to really maintain the results. I've been given a cleansing oil by Skin Profusion, which I'm using morning and evening. It gives an incredible glow. I'm also using a Retime Serum by Skin Profusion. It's really helping with the collagen and smoothing of the skin.
Okay, so that's it. Smoothing is simple. It's for everyone. I really hope you have a chance to explore the 3 products. They have so much versatility and the results are beautiful. So with that in mind, over to you, Sebastian.
Wow, guys, did you see those results? They were fantastic. Well, this was really good. But I think Uliana did something very, very important because, and sometimes I have to admit, we forget this during the treatments. We forget to treat the neck. Because sometimes the neck can unmask what you did on a face. It can diminish your achievements in a face. The same thing like sometimes if you don't treat the hands, then it doesn't work. It doesn't match with the face. You need to have a balanced appearance of all of these treatments coming together. Neck and face, décolletage and neck, hands and décolletage. All of them need to be acting together. But I think what is most important about especially those treatments is the tissue rheology. And again, the master of rheology, Ferial, will tell us what is so special about these products. Ferial, please.
Thank you, Sebastian. So thank you really, Juliana, because of your presentation. And this is, as a dermatologist, really it's very important. And thank you, Sebastian, for this point, because we have some forgotten zone. And as you can return to our mother's generation, you can see the ladies, very beautiful ladies, that they face when you approach to the face and you guess their age is around 50, 55, but the neck and the hands, they speak more, and it is around 70, 65, and this is the it's pity because the previous doctors, the last generation, they didn't think about speaking about this forgotten zone. So this is very, very important to do this. So for tissue urology now, something that is important, it is two things. I would like to invite you to pay attention to, again, to these curves that they are in this data that is important. And as you can see, the crow's feet area and the peri-orbital area, they are the very, very loose one, and they are very thin skins. So you should think about the quality of the skin in this area, because they can reflect everything that they are. It's under this area. So please do not forget to think about the quality of the skin in this area. Something that is important, now I would like to give you another image for the skin thickness, because here you should go from the macroscopic view to the microscopic view. And for the microscopic view here, look at it. We should go through the skin thickness for the stratum corneum, but you know that stratum corneum is a very, very important layer as the protective layers of the skin for the skin barrier. And we should restore very, very, precisely the lipidic layers of this layer. Why? Because it's like a glue, and this lipidic layer can take and they can keep all of the cells in this layer. That is very, very important for health of your skin. And if you have a good skin barrier, you can keep also all of the contents, particularly the hydration content of the deeper layer of the skin. So now we are all the time in the skin, not deeper, because very important, this quality, and exactly it is the problem, and also the approach of the people like Juliana and the other doctors that they think about the skin quality. So we can go to the epidermal thickness. Please pay attention that the epidermis is very important. Why? It is a avascular tissue. And this avascular tissue needs you to support it by putting something on the surface of the skin. Because if you have a good quality on the deeper layers of the skin, even is a very, very good quality of the dermis, the people, the first thing that they see, it is the surface of the skin. And this surface is the stratum corneum and epidermis. So for these keratinocytes, that they are the friends of, our friends to do the best things and to do the renewing of our layer, epidermis layer, you need to put the cosmetic products and to combine the cosmetic products with your treatments. It is very, very important. Do not, let the patients, leave your office without thinking about the days after your treatment. You should give them some prescription and some products for have the synergic effect with the injections that you do. And I go to the dermal thickness, and the dermal thickness, exactly as you can see here, it is the middle level dermal skin for the very, very delicate area like the crow's feet and peri-orbital area. And you know that the characteristic tissue urology of the neck that is not in our study is very, very close to the peri-orbital area. So you can judge the neck skin little. I think that you agree with me. This is very, very close. And if, for example, you can tell to your patient that if they don't have, for example, neck product, cosmetic products, they can use the eye product also on their neck. So you can share the eye product for neck also if you cannot find, for example, a good neck product. But fortunately, in the Skin Perfusion range, we have a special neck product for the Nutri-Neck cream. And I return to the elasticity, viscoelasticity, non-contact, and you can see that the crow's feet area, there's a delicate area, and you should really, really concentrate to every layers of the skin. Do not forget the stratum corneum, do not forget epidermis, do not forget dermis, and then you can do all of the very fantastic support and very fantastic injections for each layers of the skin, deeper for the deeper layers of the skin. So this is all the things that I would like to tell you. And here, for the delicate area like periorbital area, for the fillers, you should use a low to medium G' products. You know why? Because if you use a very, very dense product, because of the thickness, you can see it, the aesthetic result is not good. So we should also use the high cohesive products and good aesthetic results with superficial injection. This superficial injection is very important. If not, you're in the very, very deeper layers. And for biorevitalization, for biorevitalization, you need something that contains non-cross-linked hyaluronic acid plus other micronutrients, oligo-elements that we lose over the time by aging. Do not forget to support your skin by this. So I go back to Sebastian. I think that you will do a very good synthesis for this session.
So thank you very much, Ferial, for this amazing knowledge transfer, what actually you did for us and what all of these speakers for us did today during the last 1.5 hours. What an amazing journey this was, starting with anatomy, going through science, evidence-based medicine, focusing on the injection technique, combining this with rheology and with the patient wishes. All of this comes together for superior outcomes. Wasn't that amazing journey, right? Well, guys, we're coming to the end of this session, and I would like to thank all of you for being with us here. I would like to thank PhilMed for the support for this symposium, especially Natalia Sukmanskaya for supporting all of this, and my amazing speakers here all on stage. Thank you very much. Thank you for being with us.